know that 80% of women found difficulty to get tailored solutions for their own health? Today, you'll discover 11 innovations within the FemTech space presented by the founders at the FemTech Consumer and Innovation Summit back in June 2024. Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. I was honored to be able to speak at the last FemTech Consumer Innovation Summit back in June, where I led a panel discussion on navigating the shift. How do we create a better business model and distribution channel for FemTech and digital health solutions in our field? We definitely had a heated discussion with two very well-established founders, one of which has a platform where she's gathering multiple FemTech solutions in the one central location so you can find them much easier, and another company led by a nurse practitioner who has found difficulty in engaging with her patients and finding better women's health solutions on how to deliver and engage with your patients. Now, I also had the privilege of interviewing 11 founders to discuss their solution and support their innovative ways to support the women's health community. So listen up to today's episode of these 11 solutions. And we would love for you to make sure to subscribe to our channel, our podcast, wherever you're listening, and make sure to take a screenshot wherever you're hearing this and comment on LinkedIn, tag me, Sabrina Runbeck. We would love to hear which solution you love the most and how you are involved in the healthcare arena.
Hi, I'm Ali Sundberg. I come from the company Haleon. I am the innovation manager for the brand Advil. So what brought me here is, Advil is one of the leading pain brands. We really feel that pain is not just about one individual. We're very particular about closing the gender gap of pain. But overall, as an organization, one of our key focus areas is health with humanity. So we're very focused on ensuring that we're closing that gender gap. We're really making every individual, no matter who they are, inclusion is at our core. And then, of course, Advil being a large brand in the US, we also feel that women, of course, experience pain and we really want to help them. It has been outstanding. Just really being around individuals of like-minded is just amazing. All these amazing entrepreneurial mindsets and the founders and the support that you could really feel for one another. So you don't really get that competitive aspect. Like you really feel that every founder, even if they're selling a similar, type of product or technology, that they really want to help one another. And it's just been great to meet these people.
Hi, I'm Anna, and I'm the founder of Embody. We are a menstrual wellness app that is private by default. There have been a lot of concerns around leakage of menstrual health data, especially in the United States since Roe v. Wade was overturned. And what we're doing is ensuring that women's data is completely safe on your phone, as well as allowing women to learn more about their bodies. So I'm in the cryptocurrency space, so I understand cryptography, which is the key technology about around making sure that this data is safe, right? I also have premenstrual dysphoric disorder, so I'm highly tuned in to the phases of the cycle, and I'm aware of supportive practices, whether they be via nutritionists or mental health professionals and fitness instructors that really help you at certain times of the month. I also think we don't talk enough about our superpowers that we have on our cycle too, and knowing when you are your best self and using that to your advantage. This is our first time We got to present at the Innovation Showcase, which was wonderful. And I've been meeting such brilliant people here. It's been a joy to, talk to people who get it and who are doing amazing things for FemTech.
Hi, everybody. My name is Elise Hibb. I'm the new Director of Strategy and Operations for Pelvic, and we're making the pelvic floor clinic accessible from home. This is really exciting because 50 million Americans, that's men, women, people of all genders, experience some sort of pelvic floor issue. Those are the official diagnosis numbers. Unofficially, and according to epidemiological studies, the number is at least 50% more. Most people don't get diagnosed or even know that they have an issue. I am thrilled to be here today at this conference. It's been great to integrate into the FemTech space and get our new novel medical device and telehealth solution out there for feedback. We're super excited to be raising $3 million to get our exciting novel medical device that collects biofeedback data on pelvic floor, connected with pelvic floor physical therapy remotely to market. We need to get through FDA, and then we'll be able to help all sorts of patients across the United States. We've gotten so much positive feedback and support, and I'm learning about the FemTech ecosystem. It's been really nice to learn partnerships are key. That's where we can succeed. And also that it's a community. We're all here to uplift each other. It's nice compared to other industries where maybe competitors are like this. Instead, it's more of a collaborative atmosphere. And honestly, I love it.
So I'm Ikram Garrett. I'm the managing director for the US for the company called ASPIVIX. Our mission is really to make gynecology modern. So we are focused on, and we have one medical device that reduces pain and bleeding for IUD insertion and other procedures. So right now, that's what is the current standard of care. It's called the tenaculum, and that's what they're using. And this instrument has hundreds of years. So we definitely need more innovation. So just to show you very quickly, this instrument called the tenaculum is used to grasp the cervix. That way they can insert the IUD. So what my company is doing is really about making that less painful and reducing bleeding as well for women. So how does it work? You just need to load it, then you place it onto the cervix, and then it will suck enough of the tissue. That way you'll be able to do the same procedure and pull it without hurting or generating any bleeding. So that's all what is it about, and that's why I was very excited to be part of the FemTech and Consumer Summit, Innovation Summit. My goal here is to connect with other entrepreneurs, investors, and be inspired, but also find opportunities to maybe partner and find opportunities to grow. So looking forward to the next session for the Women's Health Innovation Summit in September.
I am Dr. Jennifer Hinchy. I am the CEO and founder of Fertile Fertility Science. I went through 16 months of infertility and invented a medical device that conceived my daughter. We crowdfunded to get FDA clearance, and I am here today because this was the first pitch that we have gotten the opportunity to share our news that we are the only sterile FDA cleared at-home insemination kit for anyone struggling to conceive. What brought me here was the opportunity to meet so many amazing FemTech founders. This has been so inspiring. I think I'm leaving here with more energy than I've ever had. There's so many people here that are making my life better, my daughter's life better, and working their asses off to do it. And it's incredible to be around this amazing community of people that are helping FemTech and women's health and health in general just change for the better of everyone.
Hi, my name is Justina, and I'm excited to introduce you Joy, a groundbreaking innovation in menstrual health technology. The Joy Evaluation app is the world's first AI-backed mobile application that provides instant quantification of period volume and clot sizes simply by scanning a menstrual pad. Clinically heavy periods are over 80 milliliters. and an average person loses 30 to 50 milliliters per cycle. Yet there is no convenient or accurate way to measure period volume. Gold standard methods like weighing pads or counting your used products are unreliable and prone to personal bias, leading to frequent over or underestimations. Therefore, women struggle to identify if their periods are normal or heavy. Our app offers a precise and real-time data on menstrual volume, distinguishing what's normal and abnormal based on clinical standards. This not only reassures those who overestimate their bleeding, but also prompts those in the abnormal range to seek medical advice. This fosters better communication between patients and doctors, speeding up diagnosis and treatment. We are on track to launch our product later this year. Currently, we are conducting two clinical trials. And we are also launching a line of innovative period care products, including our flashable liner, launching later this year. I am excited, very excited to be here and meet like-minded people, network, speak to investors. I think we are all in this together, creating this great community, and I am excited to look forward to catching up with all of you soon.
Hi, I'm Kirtika Parmeshwaran. I'm the founder and CEO of Vital Start Health. We are a University of Pennsylvania company that has developed the first women's mental health platform using virtual reality. We are across multiple devices, 2D as well as 3D, and right from preconception through birthing and menopause. Well, I'm all about innovation. We're doing something truly innovative and unique to drive equitable care, but using the top-notch and the best technology possible for optimal mental health, such as virtual reality, which is much more engaging and provides better adherence according to studies and the ones that we are doing as well. FemTech Innovation and this group that has been running women's health innovation events has really been instrumental in helping startups like ours to have that visibility and reach and drive partnerships as well as investor connections. So I'm excited to be here. I was part of the pitch showcase yesterday. It was wonderful to be with a group of folks who actually got this, who understand the big need and see that true $1 trillion opportunity as McKinsey and others have spoken about.
Hi, my name is Michelle Marzullo, and I am the chair and professor of the Human Sexuality Department at the California Institute of Integral Studies in San Francisco, California. I'm here today to promote our new Master's of Science degree in Critical Sexuality Studies with a emphasis in sex tech. And so just talking to lots of people, really excited about the synergies at this conference and about folks who can really understand the intersection of sex tech and femtech and product creation and product services for women and people of all genders in regards to improving our lives through technology. So it's been really exciting to be here meeting other founders, meeting executives in the mergers and acquisition space, meeting venture capitalists, and of course just meeting people who are so passionate about the products that they're creating. I can really see the synergies for education, which is the space that I'm in, and putting that learning to work in really practice and applied spaces like this. It's just been wonderful. I've learned so much, even as an educator. It's been such a generative space. And the people here are so incredibly approachable and friendly. There were smiles everywhere. I just highly recommend the conference and the experience.
Hi, I'm Rhiannon. I'm the CMO and co-founder of Ovum. And we're becoming the trusted one-stop shop for all things fertility. And we'll demonstrate improved fertility outcomes using our products and services. Now, Ovum is really here because of Jenny, my co-founder. So Jenny is a lawyer and she's an ultra-endurance athlete. And she attempted to set the world record for the fastest solo ski across Antarctica. And it was an incredibly tough experience for her. And when she came back, she started her conception journey. nothing of kind of her experience in Antarctica, physical or mental, compared to what it was like trying to have a family. So she created Ovum, which is kind of the company that she wished she had when she was trying to conceive. And we're kind of aiming to become the place where support meets science and a trusted source of information for anyone who is trying to conceive. So we have 2 products. The first is our patented preconception food supplement, which is rocket fuel for your eggs. So the supplement is backed by over 550 clinical studies and research papers, and it has a microactive form of CoQ10. So we're the only company in the world to use this. It's 3.7 times more absorbable than any other form of CoQ10 out there, which makes us quite unique. We're also the only supplement company to annually review the research and update our formula as and when needed. Our second product is our fully recyclable pregnancy test, which has just launched into the biggest retailer in the UK. I really love coming to conferences like this because there is a huge sense of community, and I think especially in the FemTech world, there is nothing better than a community of amazing like-minded founders who you can kind of bounce off, learn from, engage with, partner with, and there really is no sense of competition. Like, everyone is just there to help bring each other up. So it's the most incredible environment to be in.
Hi, I'm Stephanie Sober. I am the Global Director of Medical Affairs for Perrigo. And our mission specific to our Global Women's Health Division is to create easier access to reproductive health solutions for women and people throughout their reproductive journey. So we're working on expanding our mandate a bit beyond contraception and emergency contraception. This is the second or third iteration of this conference that I have attended. And, you know, these FemTech conferences are really a great opportunity to talk with people working on all different types of areas within the women's health, FemTech, repro health space, whatever you want to refer to it as. And I think give people the opportunity to really network incredibly well and, you know, bounce ideas off of one another and figure out where there are potential opportunities for partnership or, you know, working together in some other way. So it's really been a great experience at this conference and at the other ones that I've attended in the series.
Hi, my name is Varun Kapoor. I am the co-founder and CEO of NeuroHealth. We are a molecular diagnostics and genetics company located in California, creating non-invasive tests for women across the genetic and reproductive sphere. And really happy to be here at the FemTech and Consumer Innovation Summit in New Jersey. I decided to come here today and spend the last 2 days, and at the conference, really to learn about not just what others are doing in this space, but also to gain expertise, gain partnerships, and network with peers in the women's health sphere. Women's health is a hugely underrepresented area, hugely underfunded, and there's a lot of innovation that's been made recently and that's going to continue to be made. And I think really being able to collaborate with others and partner together with other female founders and other individuals who are really making a big impact in women's health is important to us at NeuroHealth and important to me personally. And so really great to come here and be a part of the summit, and looking forward to coming back next year.
Whether you are a consumer or a founder or innovator in this arena in women's health, we would love to hear from you. If you have an inspirational story, please apply to our podcast. We would love to share your success. Go to theprovidersedge.com to apply, and make sure to take a screenshot of this episode and let us know. Post on LinkedIn, tag me, Sabrina Runbeck, on how you are actively involved in improving the women's health industry, whether you have a solution, a service, a wearable, or a platform. We would love to hear your insights. Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.